Good afternoon, everybody. My name is Dr. Masood Nazir. Thank you very much for joining our Horgan Health Facebook live stream. We've committed to doing this on a regular basis because there's a lot that is going on, and we're really keen to make sure that our patients and those who join us today are aware of all the critical things that are happening, and also for us take an opportunity to answer some of the things that are worrying you and that are concerning. There's a lot of information on the news. There's a lot of information on Prime Minister's briefings and in the papers, and sometimes it's difficult to know how that relates to you. And what we try and do on these live streams is cover off the key topics and things which would help you and understand how you can continue to access healthcare at Horgan Health, the way we're working, and possibly even answer some of the difficult questions that you or your family may be worrying about. On this live stream, as always, I've made sure I brought along some colleagues from the practice, and we're going to cover off a couple of key areas. We'll talk about the COVID vaccination program, which I know a lot of people are asking questions about, how that's going, people who are eligible, how they're being recalled. So Dr. Abdulrazak is kindly going to join us in this session and talk about that. We're also going to talk about appointments, because again, people are worried about actually how they access appointments. You know, we continue to remain open, but actually, what's the process for getting an appointment? How does it work? People have got questions about the appointment system. People have got questions about mental health and accessing mental health services, services for pains in their joints, aches, backache. What can we do to help you with that? So we'll cover that off. And Dr. Cartmill will be joining us to be able to do that bit. I've also got Andy Jones, who's our patient services manager. He's going to talk about the lots of questions about the carers group, about how we look after patients when they do come for an appointment at the practice, and what the policy at the door is and why we have it in place. So she'll be able to explain that and go through that. And also Andy's been doing a lot of work, not just at the practice, but actually in our locality and wider. Actually, how do we look after our BAME groups, which in Birmingham, and what could we do more to make sure they feel comfortable accessing services and getting help. So those are the key sort of things we've got. And as always, I would encourage you, please, to submit your questions, because as well as the questions that you submitted via the poll, and thank you again for those who responded to our Facebook live stream poll and sent in questions already, and we've captured them and we will cover them off today. We are happy to answer any questions that you submit as we go along, because it's really important we do that. So on the first slide I'm going to come to, from the welcome, I think, Phoebe, if you move us on to the next couple of slides you've got. As some of you may be aware, and actually thank you to those who follow, GPs behind closed doors, and 2019 seems a long time ago. The whole of that year we spent with our patients filming what it is like to be in a GP practice. And that series has been broken down into sections, and we've had 2 lots of seasons of it, and this is the third one now. There's quite a few more episodes to come, but it's back, and it's on a Tuesday evening at 7 o'clock on Channel 5. And again, it may remind us of times when things are very different, and how times have changed in that year. So again, thank you for all those who participated in it, and thank you for all those who watch it and send us lovely messages. Really grateful for that. On that note, Phoebe, next slide, please. I think I'm just making sure we've got the slides. I think I've given my update. I'm going to move us on fairly quickly and bring in Dr. Abdulrazak, who's been leading on the COVID vaccination program at Horgan Health. So over to you, Dr. Abdulrazak.
Good afternoon, all. Thank you, Phoebe. Thank you, Masood. It's a quick update regarding our COVID vaccination program. The good news is, that we've up to date vaccinated up to 9,000 of our patients in the locality. So we're still doing weekend clinics, and we are doing a few of the weekday clinics as well to deliver the COVID vaccine. this week alone, we've managed to do a little outreach clinic to a local mosque in Whole Green Health, and we were working with our PCN partners, Northbrook Practice and Swanswell, to deliver this project. It was a hugely successful project, you know, so it was a good test of concept to try and reach out to the communities where there's issues and concerns about the COVID vaccine. Phoebe, we've had questions, I believe, regarding the COVID vaccine. Yeah. So we've had, you know, numerous of questions either on the phone, on the website. Just a update at the moment. We are delivering cohort 6 and above, so 6, 7, 8. Cohorts 1 to 6, and we're going down to cohort 7 soon. In cohort 6, obviously the biggest issue is the carers definition. We've had lots of carers ringing in asking about I'm a carer. So a carer is someone who provides care either for a child or an adult who's vulnerable, frail, or due to any medical conditions, but without whom the person who's being cared for would not be able to support to cope. So it doesn't have to be a paid carer, although those who are in receipt of carer's allowance will have received a letter to invite them to the mass vaccination sites, in this case the Millennium Point and the Villa Park. Having said that, if you are a carer and you're in receipt of one of these letters and you want to be vaccinated at the practice, we're more than happy to do so. Second question is, can I choose the vaccine I have? My answer to that is the vaccines are all highly effective. We're currently delivering the AstraZeneca Oxford vaccine and the Pfizer vaccine as well. What I would say is perhaps not to ponder and choose a particular vaccine at the expense of delaying your first dose, because that would put yourself at risk. Obviously, there are medical considerations, and if you think you are one of these groups who have got allergies or a history of anaphylaxis, please do highlight that to us so that we can ensure that you get the one that is best for you. Question about side effects of vaccines. So both vaccines, now that we've delivered it since December, both vaccines have got quite a similar side effect profile, not too dissimilar to the flu vaccine. So the majority of the side effects are short-lived, within 24 to 48 hours. It is quite rare for them to persist beyond the week. It will be symptoms like a temperature, feeling slightly under the weather, flu-like symptoms, but they're quite quick to resolve, and they're normally self-managed. Any other questions, Phoebe? Oh, okay. So it's not requirement to be issuing a card, although we do give our patients the vaccine card. So if you think that you have not been issued one, it's easy. Please contact us. We'll be more than happy to issue one. The card is actually more for reassurance, and a lot of patients are wanting to carry it. The notification goes straight to your GP notes. So whether you are registered with us or with our partner practices or with your own GPs, your GP notes will be updated with the dates that you've received your vaccine. So there is something there. So the card's not a requirement, but I do know that some people would like that for their own record, so that they can carry it around. Okay, so this is a question regarding a patient who's 52 with no underlying health complaints has been called for her vaccine, though her husband, 48, hasn't. So it's very difficult to comment on individual cases, because sometimes it's because of a flag of carers. So the ones that have been called in early ahead of age-wise. Is the only reason would be if they've got a CARES flag or CARES code on their system. Definitely, we are not going down to 50-year-olds based on age alone, and the ones that are being vaccinated ahead of schedule would be because they've got underlying health complaints, or if they're a carer, or if they're frontline workers, frontline health workers. So it's difficult to know, Liza, but my suspicion would be is because they are probably they've got a code of carer on their system, because that's what we've been going, the list that we've been going through. For women trying to conceive, are they advised against having the vaccine? Okay, so the question about this is, when we had the Pfizer vaccine first in December, the generic advice then, because of it being a new vaccine, was for women not to try and conceive within the 12 weeks of having the vaccine. The guidance has changed. It's not a complete contraindication. So they would say that it's safe to conceive, but if you're thinking about conceiving, we would recommend having the AstraZeneca ahead of the Pfizer. ACOX green seems to have a lower uptake. Oh, okay. So what do you mean by ACOX green seems to have a lower uptake? And where did you get the information? I mean, if I get this correctly, I mean, there are pockets within, because we're a big practice and the PCN covers even a bigger area, we do realize there are pockets of areas where the uptake is slightly lower compared to our local averages in Birmingham. So the initiative to start the mobile clinic was done to try and address this issue. But I'm sure that and the CCG has got an oversight of different areas in Birmingham. If you mean that this is ACOX green within our PCN catchment area, we are looking at means to improve uptake. We haven't got specific dates because as I said, the first test of doing a mobile clinic only happened this Thursday. But should the plan goes ahead, the idea is to try and set up mobile vaccine clinics in the future. Okay, so the 44-year-old has had pneumonia. Again, if he's had other clinical conditions like any other respiratory problems, for example, asthma, if he's got any other medical conditions listed in the cohort 6, he's likely to get an invite soon. If he is 44 and is otherwise fit and well with a one episode of pneumonia, he will be called when his date is due according to his age, really. We're not doing 44-year-olds at the moment. Okay. Yeah. Again, so lots of our allergy questions. In fact, the vaccines are deemed safe for a lot of the allergies. However, if you have had an anaphylaxis, and by that I mean a serious allergic condition where you've needed to go to hospital for medical attention, or if you carry an adrenaline EpiPen, we would not be offering you the Pfizer vaccine. However, in a lot of allergies, if it's not known, if you're not known to be allergic to the components of the vaccines, you are okay to have either. Okay, so the group 6, so if you're on immune suppressants, you are in that category. So in fact, that you should be getting a call soon, and if you are entitled. So you're the group that we're vaccinating now. Let's have a look. Okay, so the process for second doses, I think this is the problem, because when we first started out, we gave patients an appointment for their second dose. The delivery for our vaccines is still, it comes from central government, it comes via the CCG. We do not know well ahead about when we're going to get the which doses on which dates. So we get about a week's notice, notice of like next week's delivery. So and that's why we have not been able to give patients specific dates. So there is a recall process. So those of you who've had your first dose, you would not need to ring in to request for your second dose. There is a recall process in place to try and prioritize those who are due for the second dose. I know there's a question about or concern about Muslim patients having their vaccinations in Ramadan. There's lots of official communication coming from the British Islamic Medical Association about this, and I'm sure we'll be able to share this on our website via our social media person, Phoebe. Okay, so I think with this is quite specific, so we'll probably need a bit more details about this. I would recommend that you perhaps ring and speak to one of us so that we can look at your case in detail regarding the thrombosis and stroke. Okay, Masood? Thank you.
Good afternoon, everybody, and thank you so much for taking the time out to join us. And welcome to people who perhaps haven't joined one of our live streams before. You're very welcome, and it's great to see such fantastic interaction from the people watching and engaging. So everybody's very welcome, and it's great to have your questions and your attention. So Dr. Nazir has asked me to talk again about appointments, and I'd love to be able to one of these days to say something new and exciting for you. In a way, it is exciting that we're able to maintain exactly what we've been doing throughout. So to reassure people who perhaps weren't able to have that reassurance at the previous Facebook Live event, we are still open. We've always been open, and we're continuing to offer appointments. So in order to book the appointment, obviously, we're delighted to say we've had an increase in uptake in the use of our online appointment request form. And this is really fantastic and really helpful because it does allow us to see what it is you want the appointment for and make sure we're doing our very best to meet your needs within the time frame that's appropriate for the condition. So one of the things, as one of the doctors triaging those requests, is it is really helpful, as well as the initial tick box for the sort of thing it is that you want to see the doctor about, and an initial sort of headline around the problem, is if you also fill out the additional details box, which gives us a little bit of the information, the same sort of information that you would normally give when the doctor says, what can I help you with, or what can I do for you? And you launch into what it is that you want to talk about. Having that information in that little additional information box really helps us work out how quickly you need to be seen, and also whether it's most appropriate for you to see one of our other clinicians, or indeed your usual doctor about the problem. So for those of you that aren't comfortable using online, of course, we've also got the phones, and those of you who are using the phones will know that our receptionists are doing their very best to pick up the calls as quickly as possible. Please don't be disheartened if you hear that you are 50th in the queue or whatever. We have a large number of staff involved and on the phones and taking your calls at busy times. So please don't hang up, hold on, and our receptionist will speak to you and will ask the same sort of information that you can put in the online form. And either of those routes will allow your request to be triaged and appropriately then given an appointment that will meet your needs, hopefully, at first point of contact with us, rather than you perhaps seeing somebody who's not as appropriate and then needing several appointments in order to sort your problem out. So coming back to online access and appointments, there is we've got what's called Proxy Access for parents who want to register for online access for their child, and this is something that's relatively new, and it will prevent the confusion of a parent ending up with an appointment when actually what they were requesting was an appointment for their child. So if this is something that you would like to avail of, then please go online, and you can put in registration into the search box on our website, and it brings up online access registration, and that allows you to register. And you should also be able to register for Proxy Access through that same avenue. If there's any concerns about that, or you're experiencing any difficulties, then Andy, our patient services manager, will be really helpful. We'll be really happy to help you set that up, because what we want to do is make it as easy as possible for you to contact us and have your needs addressed and get the right sort of appointment that you need. So coming to appointments, obviously we're running appointments face-to-face for our with our HCAs and with our nursing team, and because they're involved in practical procedures for you, such as changing your dressing, removing stitches, doing a blood test, all of that sort of thing, then obviously they're face-to-face appointments. And similarly for smears with the nurse, obviously that sort of thing has to be face-to-face. For all GP appointments, we are triaging them to see what needs to happen, and unless it's very obvious, the very vast majority of cases, in the first instance, you will have a telephone consultation with your GP. And this is so that they can assess the problem, and if it is possible to resolve the problem by making a diagnosis and giving you appropriate treatment without the need to bring you into the surgery for an examination, then they will do it all remotely, either by phone or video if you prefer. If you do need an examination, if the doctor can't make a clear diagnosis or management plan with you without assessing you physically, then they will bring you in for that face-to-face appointment to be sure we're giving you the right management. For those of you who have been shielding, we've still kept Shirley Road as our site for those that have been shielding and are perhaps concerned about coming to the main surgery. But what I would say is, as increasing numbers of people are being immunised, that differentiation is less stringent now. And to reassure you that if you do need to come on site to Hall Green Health, we are still making sure that your temperature is checked as you're coming through, and I'm sure Andy will update you on that in a moment. And we are doing everything we can to keep the surgery clean and safe and COVID free. Now, I know lots of people are keen to hear about the possibility of face-to-face appointments with their GP. As I've said, at the moment, we're triaging that appointment, and you will initially get a phone call with your GP. But if your GP feels that you need to be seen face-to-face, then that is what will happen, and your GP will be able to organise that and meet your needs in that way. The other question around face-to-face appointments is that I think people have expressed concern about physio, and what I would say is that physiotherapy appointments, district nursing, clinic appointments on site, and chiropody appointments, although they're in the same building, they are from a different organisation, and so we have no control over how they allocate their appointments or how they're operating at the moment. What I can say, though, is that we are still referring into those services, and you can also self-refer directly into physio. And although they're not seeing people face-to-face at the moment, they are assessing what the issues of concern are and recommending a treatment, a course of exercises or whatever, in order to help you manage that condition. And we are still running, we started up again at the end of the summer and are continuing to run our joint injections service. We're still running blood tests, and Face-to-face appointments are continuing, and I'm sure as lockdown continues to ease and people become more relaxed and more people are immunised, that there will be a gradual move towards opening up. But I think we do need to be realistic and we need to be sensible. Although people are being immunised, there is still a lot of coronavirus out there. You know, Birmingham and Solihull have been one of the areas that have been slower to come down than other areas of the country in terms of cases and R numbers, and the hospitals have been full until very recently, including, I'm sure you will have seen on the news, people being airlifted from our local hospitals to elsewhere in the country because ITU beds locally were full. So we do still need to be cautious, we need to be careful, we need to be making sure that we are safe. We don't know what the situation is going to be with new variants, we don't know what the situation is going to be coming into winter, and it remains to be said that your safety is our key priority and key concern. So we'll be reviewing the situation, but at the moment we're continuing with the process as it has been for the last few months that I think we're all getting used to. So I hope that answers any questions or concerns around appointments and how we're operating at the moment. Thank you.
I had it on mute. So as always, a classic thing with trying to make sure there's no background noise. So thank you, Dr. Cartman, and thank you, Dr. Abdurazak. I'm going to just cover off a couple of things, and then Dr. Cartman, we may just talk about mental health and bring you back on in a second. But there are a couple of things just to surface on that. One, it's worth noting that up until now, we've completed at least almost 8,000 first doses of the COVID vaccine just for our locality, and that's a huge number of completed vaccines for our patients here. And so we remain committed. Like I think Priya said back in December, when the opportunity came up for us to put our names forward to be a site for our patients in our locality for the 3 practices, we jumped at the chance, and we're in the very earliest cohorts to be able to do that. And so we remain keen to be able to do that. The question that we had about patients and how people are allocated, there is a very difficult, it's not an easy process to be able to assess which patients should come in which order. And I know even the government departments have had to take lots of things into consideration, and lots of information keeps changing. So our systems do alert us to when patients fall into that category. It's not always obvious why a person's been called, until, as Dr. Abdurazak said, you look into their medical record in detail. Something's happened at some stage, which is why they've ended up in a particular category. But please be reassured, we are doing our best. As soon as we get vaccine, we don't keep any in stock. We do our best to get it out and make sure our patients are identified and in the order we've been told to do, get them vaccinated. Which I think is a critical thing. I think that was pretty the key thing. I think I'm going to go back and the second doses again, as Dr. Abdurazak said, there is a clear system, and we've got a robust process about second doses. I'm just sort of reinforcing that message. The last thing I wanted to do, which is one of the things I wanted to just bring in, Dr. Abdurazak highlighted the success of the pilot type thing we did at the mosque in Hall Green, and thank you to the patients who attended. Thank you to colleagues at the mosque who helped organise that. But we're also on this live and reaching out. If you've got other ideas of how we could do something similar in our community, I'd be really keen to understand. I did see that question earlier on about ACOG-3 and actually maybe the uptake being not as good in ACOG-3. If you have some insight into how we could do things differently and actually reach some of the patients who are worried about this and have some suggestions about what we could do, please let us know. I'd be really keen to hear them, because we are committed to trying to get all our patients vaccinated. And actually the process for that. So if there are people who are concerned and they fall into those high-risk categories that we're already vaccinating, but for whatever reason they've not had their vaccine, and there's some ideas about how we could do it, please do let us know. So I'm going to go back to Dr. Cartman just for a section on mental health, because that's a question that we keep getting, and any questions that come up in the chat that are relevant to her area, and then we'll move on to Andy after that. So Phoebe, if I'll let you go back to Dr. Cartman.
Hello again. Thank you, Dr. Nazir. What I'd like to say, I mean, we touched on it last time. obviously the pandemic and all of the restrictions that we've been living under for almost a year now has invariably had an effect on large numbers of people, and certainly we are aware of the impact on people's mental health, and in a way it's astounding the resilience that lots of people have demonstrated in finding ways to cope with the situation and moving forwards. And I think we're not out of this challenging situation yet, and as time goes on, even people who seem to be managing well and coping well at the beginning may be finding it becoming a bit more of a struggle. I think all of the health service are aware that the mental health impact of this pandemic is going to be felt now and ongoing in the future, and it's something that some resources have been made available. Now, last time I spoke about the various NHS apps, and we've put them on our website for ease of access for people. And people can also self-refer through to Birmingham Healthy Minds. All you need to do is put Birmingham Healthy Minds into your search engine, and they will, and you can then look at all of the resources that are available there and self-refer through in order to access counselling and CBT and all sorts of other treatments. That's the gateway through, and you don't need to see a GP in order to be able to access those services. You can self-refer, which is fantastic to be able to deal with that. The other thing that I don't think I mentioned last time is that our CCG, very near the beginning of this pandemic, put together a number of services to help people cope with the impact of the pandemic on their mental health. And again, we've listed some of those on our website, and I'll make sure that the numbers are on there going forward. So there are telephone contact numbers for adults, for 11 to 25-year-olds, and for those under 18, both in Birmingham and in Solihull, and other online resources specifically targeted to young adults as well. So I'll make sure that those resources are available on the website following this event, unless they're already on there, of course. So then I have got something that's really exciting to let people know about, and that is in an awareness of the impact that this situation is going to be having on people's mental health. Our primary care network, that is the 3 practices, Hall Green Health, Northbrook and Swanswell, have made the decision that we are going to invest in appointing a mental health worker. And the exciting news is that we have appointed a mental health worker, and we are going to be looking at getting that person into post and working as soon as possible to help support the patients of those 3 practices. So this is in addition to the support that you're already receiving from your GP, in addition to the support that is being provided through Birmingham Healthy Minds and all of the other resources. So what we're hoping is that there will be a resource available that's going to meet your needs as an individual. So if you are struggling, don't struggle alone, reach out. There's all sorts of organisations and support available for you. So don't be afraid. The hardest step is often that initial step to recognise there's a problem and reaching out for help. So please, if you think about it and you think it's something that you would want support with, then if you don't want to approach us, that's fine. There are online resources that will allow you to explore what you might need. But equally, if you speak to us, we might be able to help signpost you and talk you through what might be most appropriate for you. So we're here for you. We are proactively looking at what might be needed going forward, and we're looking forward to, at a future event, being able to introduce you to our new mental health worker. So that's all from me, unless there are any questions. No? In that case, then I shall hand you over to Andy, our Patient Services Manager, and thank you for listening to me.
I've just done exactly the same with the muting. Good afternoon, everyone. It's a pleasure to say hello to you all again this afternoon. So there's just a couple of things that we'd like to go through. So I'll ask Phoebe if she can actually bring the slides up, and it's just regarding our door policy yet again. Okay, so if you do have a face-to-face appointment with us at the practice, then what we're asking you to do is that when you come to the front doors, there is a doorbell just on the right-hand side as you approach the door. So we're asking you to ring that doorbell. There are signs pointing in the direction, just to ring the doorbell. And on that, you will be greeted by one of our receptionists that's actually going to be checking you in when you come into the building. But once you do that, there will be the receptionist that will speak to you through a telecom. Okay, so they will be asking you questions, whether or not you've got an appointment to come to the surgery, to be seen in the surgery, or whatever the query is when you come to the door. When you come to the actual door, if we can have the next slide, please, Phoebe. When you're allowed into the building, you'll be able to see that as you come in, on the right-hand side, there is a thermometer. Okay, it's an electronic one that's on the wall. You will be shown, there are diagrams there just to show you how to approach the thermometer, take your temperature, and there is also a hand sanitizer machine there. Please do use the hand sanitizer, and the receptionist will call you to the reception desk on the approach to book your actual appointment in. So that's what we would like all our patients to do. If you have an appointment at the surgery, this is our new way of taking your temperature and making sure that you are safe to come into the building and to be dealt with by the clinicians. Okay, so we have questions here also regarding the carers, and I am pleased to say that there's been a group now. Sorry, I will go back before I go to carers. When you do come to the surgery, we are asking you to wear your face masks, okay? I know this can be problematic for some people, but if you're unable to actually wear a mask, then those actual visors that you can get, hopefully that can help you. We do want you to be able to be safe and also to protect our staff that's in the building. If there is a clinical issue as to why you cannot wear a mask, yet again, please notify us in advance of your appointment so that we can speak to the clinicians, and then they will, as Dr. Cartmill mentioned in one of our last live stream, will make allowances or put something in place just to make sure that you are safe when you come to the surgery. Okay, so that's that on the door policy. Thank you. So going back to, there was a question asked regarding carers. So I'm pleased to announce that there is a subgroup that has been set up for the carers, and they had a meeting. So what they are going to do now is they've set a date for a meeting on the 12th of March. So there is a meeting going to be hosted on the 12th of March for carers. And this meeting is just to explore the areas, what the needs are right now, what we can help with as a practice. And also we do have the Forward Carers Hub, the Birmingham Forward Carers Hub, that will be possibly joining that meeting. So any questions that you do have, please send them in to us on the website, because we can then go through them and put things in place so that we can answer those questions for those of you that are carers and, you know, just need some help, you need a bit of, you know, light relief to be able to discuss issues that you've faced through COVID. So we have got a team of people that will be there, mostly patients. So the team are made up of patients. So the carers event is on our Facebook page. So please do join us and just let us know any of your questions. So that's on the carers, and I'm excited to know that we're coming back. You've asked, and we're happy to say that we've managed to get that up and running for you. Okay, so I'm actually going to go on to the next point, which is if those of you that are new to our Facebook page and live stream and not know, in the last meeting, I was appointed the BAME and inequalities champion for the PCN. So Northbrook, Swanswell and Hall Green. So this is an area that which is much needed in the area, and we're looking at things for our BAME patients as well, and it's just that we could do with your help. The main drive right now is the COVID vaccine, and it's making sure that we are inviting those patients that, you know, they are vulnerable, they're in an area, and it's targeting them. And as mentioned before, we've started off with the local mosque, and that went really well. That was a good drive. So we're asking our patients, please, you know, if there are if there's anything that we can do to get the message out there that it is important to have the vaccine. You know, we want to protect you. We want to make sure that you are safe. And if there are any questions that you do have around the vaccine, you're not sure, you know, you're not quite made your mind up yet whether to have the vaccine or not, we have, you know, very dedicated clinicians here at the surgery within the PCN that can answer all those questions for you. You know, the uncertainties about the vaccine, please give the surgery a call, speak to the professionals. They know what's in the vaccine. They can allay your fears with the vaccine, and that's what we're driving to now. So please just come and get your vaccine. That's all we're asking for. We want to protect you and society at large. And if there's any other questions, I'm happy to answer those, but I'm sure things that I've missed that Dr. Nazir, Dr. Cartmill and Dr. Razak will actually answer for you. Thank you.
Thank you, Anne. Thank you, Andy. And great to have you appointed, Andy. It's something I think we've spoken about for a long time, and actually to see the role in place and see the great work you're doing and the results it's achieving is amazing. So thank you so much for that. What I'm going to do now is probably I will ask Phoebe to bring in the rest of the panel so with questions, but we will start looking at the questions you've posted for us, because I'm really keen that actually each person, so I think that they're back on screen now, are available to answer any questions that you've got for us. So Phoebe's going to bring up questions, and I will then ask either Dr. Abdulrazak or Dr. Cartmill to help us with that. And so the first one I've got on here, and we'll highlight the person is, that's fine. So it's a question about, but when booking a smear test, it asks your preference, that gives a date, but does not let you accept or change the date. You have to phone or change. That's fine. So that's and Sue, I was going to say all our patients, the feedback you give us really does help us with the process. So Sue, that is really, really helpful for us, because actually what I wanted us to do was to make it easy for patients to book a smear test, and we didn't want them to have to ring the surgery to do that. As you clearly highlighted, even though we've got a process which is helping a lot of patients, it's not quite where we want it to be. So I will take that as an action from this live stream and ask our team who do the recall to see how we can modify the system to reflect what you said. So again, this is why I so much enjoy our live streams, because this sort of feedback is really important, and actually we want the service to get better and better and make it easy for patients. So I'll take that on board, and we'll update the system to reflect that. Next question, please. So Joseph, and I might, okay, so I'm going to ask Dr. Abdulrazak to probably pick this one up, if that's okay.
Okay, so let's have a look. I've just had IV steroids, was told I would have to wait at least 2 weeks before and vacation, but I'm having steroid treatments every month from now.
I think it's probably vaccination, but do you want to?
Are you sure? Yeah.
I'd have to wait at least 2 weeks before vaccine, and I have a steroid treatment every month for my. I'm assuming it's vaccination. Erin, would you respond on that basis?
With intravenous steroids and certain immune suppressants, there has been guidance about 2 to 3 weeks after having that before you have your vaccination. So that's probably correct. But if it's going to be a bit of a tricky one, if you're having it regularly, perhaps it's something that we need to discuss with your consultant.
Yes. So Joseph, would encourage you, Joseph, to probably contact us. Your consultant will have some advice, but if you contact us, we'll happily work with you to make sure we can get this sorted out for you. And that's why, as Dr. Abdulrazak said, there are some scenarios where we have to do this, but we're more than happy as a practice and comfortable to do that. Sukhvinder, and I think it's a really good question about, is there any support for patients who are suffering with long-term COVID effects? Yeah. So Dr. Abdulrazak?
Yeah, thank you, Sukhvinder. I think the government on a national and local basis have realized this. There's a need for this. And so, in fact, we're quite lucky that we have a local long COVID clinic that we could refer to. So long COVID is what they define as having persistent effects of the COVID vaccination for more than 12 weeks. So definitely a year later. So definitely contact us so we can refer you to the right services.
Yeah. Thank you, Dr. Roberta. And like I said, the more being learnt about it, and more even learning about how to manage it, and maybe hopefully even some medications that might come through at some stage that may help people. So I think that's all happening at reasonable pace. Thank you, Sukhvinder. Next question, Phoebe. And there may not be a next question, but I'm just checking if there are any other questions. Okay, I can't. 1 second. Not true, doctor. Not taking new patients due to COVID have been 6 months in pain. Taking new patients. Sorry, Nigel. I'm just trying to make sure we understand your message. My knee needs sorting out. No physio. Yeah. Dr. Cartmel, I don't know if you want to just talk about how the physiotherapy service and some of the challenges. And you're on, Dr. Cartmel, you're on mute. Sorry.
Is that a hat trick? That's 3 of us anyway. I forgot we were muted. So Nigel, if your knee needs sorting out, then what I would suggest you do is, if you've already self-referred to physio and haven't been successful either in getting through, or indeed if you've struggled and they've got through, you had some exercises and it's just not improving, then I think it is worth getting back in touch with us, arranging an appointment so that we can discuss exactly what is going on with your knee, and so that we can then determine what the next step would be. We have got a physiotherapy practitioner who we have appointed, and it may be that it's appropriate for you to be seen by him and assessed, or it may be that actually what you really need is an injection into your knee. But until we've had a chance to speak to you and assess your knee, should that be appropriate, then we won't know how best to advise you to go forward. So please either go online or give us a call and we can book you in and then take it from there.
Thank you, Dr. Hammer. Absolutely, Nigel. Please do get in touch. And if you want it through the website, and very specifically, exactly share what you said here. Explain that on the online appointment form, and we'll take that forward. Christine, and that's a really good, Christine, that's a really good point. I'm going to ask Andy to come in. What about people with a reading disability? So I think just to help Andy, but we can point this out. I think there's a bit of background noise in somewhere, so we'll play mute them. If there's there's a bit of background noise coming in. I would say that actually we've got photos, haven't we? Andy, yes. instead of writing, there's some photos to explain how to use the temperature probe. But what we might do, Andy, and that's a really good suggestion, Christine, is possibly even post a video about it so people know about it before they come for their appointment, how the process works. So maybe yourself and Phoebe could work together and do a small video about how patients would use the temperature instructions ahead of them visiting the practice. Yeah.
Yeah, that's not a problem at all. And also there is also assistance, so there will always be a receptionist to be able to assist at the front.
Even better point. That's a key point. Thank you, Andy. Okay. Next.
The other thing I would say is, having come in and used it myself, there's usually somebody in front of you going in, and all you have to, I've observed what people are doing, which is you just wave your forehead in front of it and it gives you the reading, and if for whatever reason that fails to work, you can just hold your wrist up in front of it, and that's equally as effective in giving a temperature reading. So don't be afraid to observe what's going on around you. And as Andy has said, we've always got a receptionist there who can advise you and support you should you need that.
Absolutely. Thank you. Okay, Phoebe, any other questions? So Nigel, just going back to Nigel, you put 3 questions online. Nigel, the questions should all be when you say online, I'm assuming through the online appointment system. We address each question the same day, so they should be addressed on the same day. If they haven't, then please get in touch with Andy. Andy, we can look into any specifically Nigel. But any questions we get, usually, we try and address the same day. We make sure the clinician looks at them, especially if it's a clinical question. We will make sure that they're looked at and addressed, because it's really important for us to make sure patients need to be assessed by a clinician. They get the assessment in a timely manner. Okay, so I think I've addressed that. And Leslie, will I get the same manufacturer of Covaxin as I had the first one? And again, I'll bring Dr. Abdul-Razak in just to confirm that for you.
Yeah, so currently we're working with government guidance. The answer is yes. So if you had a Pfizer vaccine, you will be having a second Pfizer. If you've had an AstraZeneca, you will have an AstraZeneca second one. Although having said that, the guidance might change in the future, because I know of studies of looking at mixing and matching these vaccinations. So for now, as we speak, as of March 2021, the answer is yes.
Yes, thank you. So next, so Sunila, is there any way of making accounts or usernames on Hall Green Health websites currently when requesting appointments? So I think, Sunila, it's a good question. It's really important that actually we've got a bit, not on the website, but there's another way of doing patient accounts, which is what Dr. Cartmill alluded to earlier on with the Proxy Access. So I'd encourage you to probably contact us and we can show you how you could create patient accounts for each member of the family. To make sure that you're getting messages back, but also to the things we could do better with our website. I'm sure Phoebe, our social media and communications manager, will be really interested in hearing your feedback. We are keen on making the website even better, and so that our patients get a good experience of using it. So please let us know, and we can look at that, and we can also talk to you about how we can set up Proxy Access accounts. Okay, next question, Phoebe. Thank you, Hema. It's really kind of you. This is why we enjoy this. It's been all great questions, and actually, this is what we were trying to aim for. That our patients are worried about these things, and sometimes the information that's coming on the news and things isn't as clear and isn't as specific to what you were worried about. So we were keen to do these live streams to make sure you did get that information. Thank you, Hema. So anything else, Marianne? Can you make an appointment online for a doctor who's special? So, Marianne, a really good question. If I can just pick that up and then see if Dr. Cartmill wants to add anything. But the reason for the and we don't offer appointment bookings with the doctors online, because one of the questions is, and it's a commitment we made, is sometimes you have a query and you don't know if it's urgent, and you don't know which clinician is best to deal with that. And the classic example of that may be the musculoskeletal and knee pain. So we're now lucky that we have doctors who are interested in musculoskeletal issues. We now have a first contact physiotherapist, which actually most practices don't have, who actually is very specialized and very experienced in dealing with those issues. So what we request you do is you tell us the issue that you've got, and then allow us as a team to make sure you get to see the right person, okay, the first time round. Rather than seeing a doctor and they're being sent to somebody else, why not see that person the first time round who might be able to deal with that issue? If it's a particular skin issue, the diabetes issue, we have clinicians in the practice who are very specialized and very good at all those areas. So that's why we've asked you to use the website, if you can, to submit the information about the appointment, your request. And the more information you give us, the more accurate the decision we can make about that request. So I would ask you that actually we would do that. We have had many a time people frustrated where in the old days when they had a system where you just booked an online appointment with a doctor, they'd come and see somebody and it wasn't the person that they needed to see, and then they'd have to come back for further appointments. We feel that the newer system allows us to assess you and put you in front of the right person the first time round. So, but again, please feedback if you think that's not working. Thank you, Christine. It is, we're all part of the same community, and actually that's why all of us here enjoy what we do, but we're committed to looking after our community, and actually together I think we're going to be able to get through this, and we're grateful to all our patients, because actually all of you have during this pandemic also been very supportive, helpful, understanding of all the challenges, and actually all the lovely things you say about the staff and the practice are gratefully received and help the morale at the practice. So thank you for that, Christine. So that's a really good question. It's all about proxy access. So you could, and I'm not going to say anything about having problems with husbands or wives or anything else at all. I wouldn't want to get into that debate. It'll spiral into something we shouldn't be saying. But as you want to be supportive. I think that's absolutely right. There's a process for setting up the proxy access where he can be registered, and then and the team can show you. In fact, it might, Andy and PB, maybe an opportunity for us to post a video about proxy access and how we can do things and socialize it and make it easy for people to do. So yes, we can help you try and do that, so you can support your husband. In my case, I have that for my mom, just to give an example, and actually it really helps me be able to order her medications. Equally, when she gets her results of her diabetes test back, I can sit with her and go through her results with her. So these things are very helpful. So being able to do that with spouses, other members of the family is very helpful. Okay, next question. Dr. Abdulrazak, can I talk about prioritizing people with asthma on the vaccination?
So I think this is a very good question. Thank you, Leslie. The asthma has categorically been one of the biggest queries that I've had in the last few weeks, because originally it was categorized with all the other clinically people are eligible to be vaccinated under cohort 6 because you've got asthma. But the issue had risen a couple of weeks ago. The government had revised the definition for those who would be categorized as category 6 with asthma. So in order to receive your asthma vaccination, your COVID vaccination under cohort 6, you would have needed to have had a previous hospital admission for your asthma, or if there's any point in your life where you've received 3 courses of oral steroids on 3 consecutive months. So automatically that brings down the number of those eligible at the current moment for asthma. So basically, if you've got asthma that's well controlled, you've never had to have steroids, or you've never been admitted to hospital, you will be called according to your age group. So that's a decision that's been made by the government a couple of weeks ago.
Yeah, and I think just adding to that, the Chief Medical Officer, these are never easy decisions, okay? And the decision is made on the basis of actually which patients are at most risk. And if you're looking at people with asthma, those people in those categories would be at the highest risk of being admitted to hospital and of something awful happening. So Leslie, it's a really good question. It's never an easy decision to make about prioritizing these things, but the aim has been, and I think we've seen the success of this, actually vaccinating our more older patients and those in care homes has started to have a significant impact. So I think the categorization is based on identifying those at the highest risk, getting them vaccinated first, because we need to protect them. Okay, and all of us would agree that actually it's really important to avoid anybody being admitted to hospital or becoming that unwell. Okay. Nigel, online it says the phone number can, online it says which phone number can they get you on, but use a different one from what they put. Nigel, absolutely. I think we're really keen to, based on what you've just described, to get you helped and get your knee sorted. Because actually we want you to be mobile and ready for the summer, to be able to go on longer walks. So fingers crossed, all of us have got some hope for what we can do in the summer, and we're really keen to try and help you get your knee sorted. But it says online which phone number can they get you on, but use a different one. We shouldn't do, Nigel. We should be using the number that you give us. But again, if there's a matter in your medical record that the numbers aren't right, if you again let us know through the website, we will update it and make it very clear what phone number you'd prefer us to reach you on. Sometimes historically there are a couple of numbers in your record for whatever reason, but do let us know, and we can make it really obvious to people ringing you what number we should contact you on. Okay, next question, PP. Thank you, Irene. And Irene, lovely comments. And again, I'm never very good with emojis, but it's lovely to see emojis appearing in this. So thank you for that. You know, like I said, we're just here to look after our patients, and actually we enjoy it. And that's actually makes us, you know, it makes our jobs, you know, enjoyable, and actually we're privileged that we can be part of this response and continue to look after our patients. Thank you, Irene. Next one, Phoebe. Otherwise, I'll start to wrap up. Thank you, Phoebe. And so thank you to everybody. And again, this is a new format for us. So just to say that, we were keen to try it, but actually, hopefully, you know, please give us feedback. It's a new experience for all of us. We have tried various things since the start of this pandemic. We've tried various things about how we do these things. And we've learnt about getting better microphones. Today, we've all learned about unmuting ourselves when we speak, and it's so easily done. I think many of us have experienced that. But we, you know, this format hopefully has worked. I think the questions keep surfacing. We've answered more questions than I think we've had before in previous ones. So clearly, there's something about this format that people are enjoying. Hopefully, it's clear. Hopefully, it's covered off the topics you told us that you were worried about. And we'll be doing more of this. So I'll get Phoebe. We're going to do a regular cycle based on this. And if you please let us know the topics you want us to cover, we will invite various members of the team to join this. Because I'm really keen that you get to know the team at Hall Green Health and their roles. Because actually, that's just so important. It highlights the question earlier about who's the right person for me to see. We want you to meet the paramedics who are part of the team. We want you to meet the physicians associates, the nurse practitioners, the pharmacists. You know, we've got a mental health practitioner starting soon. We've got a first contact physiotherapist. You know, all different members of the team. You know, people in Andy's team, people in the reception team. They're all here to try and make the care safer and better for you. So thank you for that. Thank you also to our PPG. We've got our virtual PPG meeting this afternoon, and again, they've always been continue to be very supportive of us getting this right. They represent you. They tell us about the issues that you're facing, and they highlight them to us. They help us work out assess new solutions that we have for processes we want to put into place. They almost act like guinea pigs in the initial bit and say to us, this process is good or bad. So I'm really grateful to the PPG. They continue. John Wright and the team are always very responsive, very supportive, and there to help, which I think is great. The last point before I complete is we do value feedback. And many of you will notice if you have an appointment at the practice, probably shortly after you've had the appointment, you will get a text message, a request asking for a survey, asking for you to feedback your experience. We do take all those things very seriously, and they help Andy and the team, you know, Phoebe and others plan how we do things. We take on board everything you say. So please do complete that feedback. You know, positive experiences, things that worked well, tell us about that. We'll do more of that. Things that haven't worked well, tell us about that. And we'll look into them and make sure we can make the process better. Okay. On that note, I'm going to thank you all for joining. Please continue to look after yourselves. Please continue to look after family, friends, neighbours. Be kind to each other. Okay. In difficult times, without you, we can't achieve any of this. And thank you again for joining. And I look forward to seeing you all at the next live stream. Take care.